6.4 Gas exchange. Ventilation maintains concentration gradients of oxygen and carbon dioxide between air in alveoli and blood flowing in adjacent capillaries. Ventilation is the exchange of air between the atmosphere and the lungs, achieved by the physical act of breathing. Gas exchange is the exchange of oxygen and carbon dioxide between the alveoli and bloodstream via passive diffusion. The purpose of ventilation is because gas exchange is a passive process and a ventilation system is needed to maintain a concentration gradient in the alveoli. Oxygen is consumed by cell during cellular respiration and CO2 is produced as a waste product. Oxygen is constantly being removed from the alveoli into the bloodstream, and carbon dioxide is constantly being released. The lungs function as a ventilation system by continuously cycling fresh air into the alveoli from the atmosphere. The oxygen levels stay high, and the carbon dioxide levels stay low. The lungs are also structured to have a very large surface area, therefore increasing overall rate of gas exchange. Type 1 pneumocytes are extremely thin alveolar cells that are adapted to carry out gas exchange. They are extremely thin to minimize diffusion distance for respiratory gases. They are abatic, unable to replicate, so if needed, type 2 pneumocytes will differentiate into type 1 pneumocytes. Type 2 pneumocytes secrete a solution containing surfactant that creates a moist surface inside the alveoli to prevent the sides of the alveolus adhering to each other by reducing surface tension. Type 2 pneumocytes are cuboidal in shape and possess many granules. They are relatively numerous but only comprise of a fraction of the alveolar surface, and they secrete pulmonary surfactant. The solution secreted makes it easier for oxygen to diffuse across the alveolar and capillary membrane when dissolved in liquid. Air is carried to the lungs in the trachea and bronchi, and then to the alveoli in bronchioles.
Let's take a look at the lungs.
The lungs are comprised of the trachea, the bronchus, the bronchiole, the alveolus, the rib, the lung, and the diaphragm. Muscle contractions cause the pressure changes inside the thorax that force air in and out of the lungs to ventilate them. Breathing is an active movement of respiratory muscles that enable the passage of air into and out of the lungs. When the volume increases in the thorax cavity, pressure in the thorax decreases. When the volume decreases in the thorax cavity, the pressure increases. When the pressure in the chest is less than the atmospheric pressure, air will move into the lungs. This is called inspiration. When the pressure in the chest is more than the atmospheric pressure, air will move out of the lungs. This is called expiration. Different muscles are required for inspiration and expiration because muscles only do work when they contract. The muscles used in inspiration are the diaphragm and the external intercostalles. When inspiration happens, the diaphragm muscles contract, it flattens out, increasing the thorax volume. The external intercostalles contract, pulling the ribs upwards and outwards, expanding the chest. In addition, there are additional muscles which help pull the ribs up and out. The muscles used in expiration is the diaphragm and the internal intercostalles. In expiration, the diaphragm relaxes, curving upwards, reducing the thorax volume, and the internal intercostalles contract, pulling the ribs inwards and downwards.
Unfortunately, you have been diagnosed with lung cancer, and you will most likely die because the lungs have a large blood supply, which means that the cancer can move around the body and be placed somewhere else, which isn't good. Lungs are also like very, very vital for the body. So without them, or when they work less efficient, it's detrimental to your health, and you'll probably end up like this little guy. The causes of lung cancer can be a range of different sorts, such as radiation, aging, pollution, and smoking. Not good news. And patient E has been diagnosed with emphysema, which is when the walls of the alveoli lose their elasticity, which leads to lower gas exchange. Most of the causes is from smoking. The consequences are shortness of breath, increased susceptibility to chest infections, and expansion of the rib cage, as you can see here. I'm sorry to inform you of this. I have other patients to see.